Hello, my name is Dan Carter and I'm the founder of Norse Foundation. Um, I would like to talk to you a little bit today about some pathology, particularly something that many of us, if you've got children or if you're help out in sports clubs or a PE teacher, will have heard about, called Osgood Schlatters disease. Now, this disease is something that normally happens to teenagers. It normally happens to boys at a ratio of 4:1. And if we're talking very stereotypically here, it happens normally to footballers. And what happens is that the young person plays an awful lot of sport, and over a period of time, the tendons and muscles get very, very tight and they pull on the soft tibial tuberosity. Um, and what happens is that you create something called an enthesopathy, and in worst case scenario, you get a bony exostosis, which grows on the tuberosity. Now, if we just back up a little bit, there's a little bit of anatomy here that we need to understand. So in young bones, we have a growth plate, which you can see here outlined in my red circle. And what it is, it's a piece of cartilage that runs along the end of the bone, and that's where youngsters grow from. And when you become an adult, that cartilage hardens and growth ceases. It's a process called ossification. Now, specifically, if you look at my slightly smaller circle, you can see the tibial tuberosity. And what happens is that the patella tendon attaches onto that. And as you play more and more football, classically, it pulls on that tuberosity and it gets very, very angry. Okay? Now, we've discussed most of this already, but you can see here in this little red circle here at the top picture that you get like this slight bony lump. It's a bony overgrowth. Now, they normally hurt to press, okay? And it's caused by these repetitive stresses. Now, what we need to be aware of is that, yes, they can enlarge and yes, they can be very, very sore, but in some cases, as we'll discuss in a minute, you can get an avulsion fracture, which requires medical attention, okay? Now, some youngsters find that these sort of patella knee straps are comforting. They help. They take the pressure off the sort of patella tendon. Other findings are that it can happen on both sides bilaterally. It hurts when you kneel. And in some cases, because it hurts so much, the children back up and you get like a wasted quadricep. Now, in terms of clinical assessment, your therapist will basically get you on your back and ask you to do some resisted extension of the knee against their pressure. And that normally reproduces pain. And if you're concerned about an avulsion fracture, then obviously x-rays are required. Now, if we go here, we can talk about treatment in a second. But first, let's just talk about this avulsion fracture. So you can see here, this is an avulsion fracture, okay? So it has pulled right off. Now, obviously, that changes things massively. That is, go to A&E, get x-rayed, and that will require medical intervention to fix. But that's very rare. So in most cases, the treatment starts because what we want to do is avoid the pressure. So avoid running and jumping until pain subsides. And in truth, this condition is self-limiting. So the pain, you'll have good periods and bad periods. You want to treat your youngsters with hot and cold therapy. I'm not one for pumping youngsters full of non-steroid anti-inflammatory drugs. So we use the hot water bottle for 2 minutes, then the ice pack for 2 minutes and go hot, cold. And so the whole thing to last 8 minutes. And that really, really helps. Knee bracing or more recently kinesiotaping can help. That's very supportive. Regular stretching of the quadricep is important to reduce that traction on the tibial tuberosity. Massage and manual treatments help a great deal. And as we said all the way through this condition is self-limiting. So ultimately, the youngsters will grow out of it. It can be very debilitating in the meantime, but you just have to encourage them to be patient and manage it carefully. In the case of boys, you sort of say to them, look, you're playing too much football, maybe back off playing football at lunchtime at school. That's the classic one. And here you can see some of our references. If you need any further help, why don't you contact us at www.norsefoundation.com. And thank you for watching. I hope that was helpful.